Hello guys, I am Shirley Dash welcoming you to the show Pharmacy and Medical Crash Course Division in the Knowledge Club online. At previous episode, I ended after discussing about the class 4 type antiarrhythmic drugs. Today, I came with miscellaneous type antiarrhythmic drugs in cardiac pharmacology. Today, I will complete the antiarrhythmic drugs chapter discussion. Stay tuned up to end because if you skip the lecture, you can miss our valuable points in between lecture. So, stay tuned up to end. I am going to start today's episode. Let's start. Let's start to discuss about some miscellaneous types of drugs for antiarrhythmic treatment. Number 1. Digitalis Glycosides and vagomimetic drugs. Digitalis Glycosides, especially digoxin, because of their positive inotropic effects, are widely used for treating patients with congestive heart failure. They also continue to be used for the management of patients with supraventricular arrhythmias. Digitalis glycosides enhance the inotropic state by increasing the intracellular calcium concentration. Intracellular calcium overload is also the mechanism of proarrhythmia associated with digitalis intoxication. The effect of digitalis on the electrophysiology of the myocytes is to increase the slope of phase 4 depolarization, an effect that enhances automaticity. The principal antiarrhythmic effect is achieved via prominent vagotonic actions. The vagotonic influence leads to inhibition of calcium currents in the AV node and activation of acetylcholine sensitive potassium channels in the atrium. These channels are not present in the ventricle. This results in a slowing of conduction through the AV node, a hyperpolarization of the resting membrane potential, and a shortening of the refractory period in atrial tissue. The peripheral antiarrhythmic actions are associated with the effects on the AV node. Digitalis can therefore be used on re-entrant arrhythmias that use the AV node as one limb of the circuit and for limiting AV conduction during rapid atrial arrhythmias such as in atrial fibrillation. Digitalis glycosides have theoretical advantages over other medications that limit conduction through the AV node, such as beta blockers and calcium channel blockers, by providing a positive rather than negative inotropic effect on the ventricles. The effects on the AV node are limited, however, in states of heightened sympathetic tone, such as during advanced heart failure. Second drug is adenosine. Adenosine is an endogenous nucleoside that is a product of the metabolism of adenosine triphosphate. It is used for the rapid termination of supraventricular arrhythmias following rapid bolus dosing. Electrophysiological actions. Adenosine receptors are found on myocytes in the atria and sinoatrial and AV nodes. Stimulation of these receptors acts via a G-protein signaling cascade to open an acetylcholine sensitive outward potassium current. This leads to hyperpolarization of the resting membrane potential, a decrease in the slope of phase 4 spontaneous depolarization, and shortening of the action potential duration. The effects on the AV node may result in a conduction block and the termination of tachycardias that use the AV node as a limb of a re-entrant circuit. Adenosine does not affect the action potential of ventricular myocytes because the adenosine stimulated potassium channel is absent in ventricular myocardia. Electrocardiographic changes. The most profound effect of adenosine is the induction of an AV block within 10 to 20 seconds of administration. Mild sinus slowing may be observed initially, followed by sinus tachycardia. There is no effect on the QRS duration or QT interval. Rarely, an adenosine bolus injection is accompanied by atrial fibrillation or ventricular tachyarrhythmias. Hemodynamic effects. The administration of a bolus dose of adenosine is associated with a biphasic precursor response. There is an initial brief increase in blood pressure followed by vasodilation and secondary tachycardia. Pharmacokinetics. The pharmacokinetic characteristics of adenosine, that is oral bioavailability not measured, onset of action 10 seconds, that is IV, peak response not measured, duration of action 10 to 20 seconds, plasma half-life 10 seconds, primary route of metabolism red blood cells, primary route of excretion renal inactive metabolites, therapeutic serum concentrations not applicable. Clinical uses. Adenosine is approved for the acute management and termination of supraventricular tachyarrhythmias, including AV nodal reentrant tachycardia and AV reciprocating tachycardia. Adenosine may be helpful in the diagnosis of atrial flutter. Adverse effects. Adverse reactions to the administration of adenosine are fairly common. However, the short half-life of the drug limits the duration of such events. The most common adverse effects are flushing, chest pain, and dyspnea. Adenosine may induce profound bronchospasm in patients with known reactive airway disease. The mechanism for bronchospasm is unclear till now, and the effect may last for up to 30 minutes despite the short half-life of the drug. Contraindications. Patients with second or third degree AV block should not receive adenosine. As indicated previously, the use of adenosine in asthmatic patients may exacerbate the asthmatic symptoms. So we completed about to learn antiarrhythmic drugs in pharmacological relevance. Total 7 episodes I made on antiarrhythmic drugs. Revise all episodes on heart thoroughly. I made it step by step accordingly. Here the all previous episodes list on heart anatomy and physiology chapter and cardiac pharmacology chapter. You will get all links at the discussion part of this video, or you can visit our channel. I will come at next episode with drugs for heart failure. Before ending today's episode, if you like this video, please like, share and comment freely. Don't forget to subscribe our channel. If you already subscribed, then thanks a lot. And after subscribing our channel, please click on the bell button for getting the regular updates of Knowledge Club Online. I am coming with the another episodes very shortly for you. Till then.